I move that the Legislative Council amendments be agreed to. Mr Chairman, we can all agree that e-cigarettes are not products that children and young people should be using or have access to. E-cigarettes have grown in popularity internationally in recent years, which is why we have acted on this issue. There is considerable debate and concern to the community regarding how best to regulate these products and whether they represent a new opportunity to help smokers to quit or are a danger to our efforts to reduce smoking rates in New South Wales. New South Wales governments, both Labor and Coalition, with the assistance of crossbenchers, have made great strides in reducing smoking rates and preventing the uptake of smoking by young people. The smoking rate among secondary school students in 2011 was at an all-time low of 7.5%. This is a dramatic reduction in the rates of smoking from where this matter was first addressed. This is an impressive achievement that demonstrates the effectiveness of our tobacco control efforts in New South Wales. We need to protect these gains at all costs. We're seeing in the United States a sharp rise in the use of e-cigarettes by children and young people. We don't want children in New South Wales to travel down this path. That is why the Public Health Tobacco Amendment e-cigarettes bill was introduced, which banned the sale of e-cigarettes to minors. The amendment so far have banned the sale of e-cigarettes on behalf of minors and extended the current restrictions on tobacco vending machines to e-cigarette vending machines. Further amendments moved in the other place yesterday will apply the current restrictions relating to the display, sale and advertising of e-cigarettes to e-cigarettes. The restrictions on display, sale and advertising will assist in ensuring that children do not have access to e-cigarettes. And also, it will apply the current ban on the use of cigarettes in cars while a person under the age of 16 is present to e-cigarettes. I would like to acknowledge the work of the opposition, the Greens and the Christian Democrats, in relation to this bill. They have both raised their concerns about e-cigarettes and contributed to debates on this bill. The bill represents a major shift in relation to regulation of e-cigarettes, which will now be subject to very strict regulation relating to sale, display and advertising of product and the use around children in cars. Furthermore, the Ministry of Health will continue to monitor the evidence regarding potential benefits and harms associated with e-cigarettes, and if further regulation is required, it can be brought before the House. I thank members for their support of the Public Health Tobacco Amendments e-cigarettes bill, and I commend the bill to the House.
The question is the Legislative Council amendments be agreed to. All those of that opinion say aye.
Aye.
Contrary, no. I think the ayes have it. The ayes